country road. This is my third pound day. It might help one drown by rain. Oh, where am I gonna go on this dark country road?
Okay, this is Dr. Thornley. I'm a neurologist and epileptologist, and I subspecialize in epilepsy, and my current interest is chronic pain. So today I'm going to go over the indications of medical marijuana. I'm going to delve more deeply into the diseases, scientific articles, clinical experience, and just to go over these because there's a lot of information out there, and I really couldn't find any comprehensive website that is patient-oriented, that'll give information based on scientific articles. When I look at PubMed, there are just so many esoteric articles talking about the molecular level and the receptors, which is fine for physicians, but this is to tie everything together. So today we're going to talk about medical marijuana and its effect on seizures. So just as a review so medical marijuana, there's the non-psychoactive portion, the CBD, cannabidiol, and then there's THC, tetrahydrocannabinol, which is more popularly known for its form in recreational purposes. However, at low doses in combination with THC, there is no euphoria. So CBD is non-intoxicating. CBD plus THC is non-intoxicating. So in the animal models, it was found that in one study, looking at Dravet syndrome, which is a genetic type of epilepsy where you have myoclonus, severe seizures, and it's found in the SCN1A gene. There's a mutation there. But in one study, they found that there are more receptors for CB1 in the diseased area, whereas the normal area has a normal number. In addition, it was also found that with medical marijuana, that it acts on when it acts on the dentate gyrus, which is within the temporal lobe. It's normally the temporal lobe tries to inhibit seizures, and when this inhibition is taken away, there's more propagation of seizures in that diseased area. So when the inhibition is taken away, you have more seizures. So what medical marijuana does, it tries to keep that inhibition going. Meaning it tries to keep stopping the seizures, what it's already normally supposed to do. Now, in some of the studies, they found that the receptors are actually increased in the diseased area of the temporal lobe, and the normal area has a normal number of receptors. So that tells you that this endocannabinoid pathway, which works through CB1, the receptors are actually upregulated in the disease state, almost as a response in compensation or a regulatory state, or for cell damage or repair, almost in a reaction to seizures. Now, there's been a recent study performed in about 171 patients on Lennox-Gastaut that came out January 2018. Half of these patients were seizures, multiple types, and then half of them were also the Lennox-Gastaut. And then on one group, they gave cannabidiol at a rate of I believe it's like 1,000 milligrams, and then the other group was placebo, meaning they had their normal seizures, and it was over 14 weeks. They found that at 1,000 milligrams, there were some mild to moderate side effects. Side effects on this is nausea, vomiting, diarrhea, dizziness, as well as sedation, and then also GI symptoms, neurocognitive. But there's nothing severe. There was one patient that died, but it was unrelated to the CBD. They found that there was a reduction of seizures of up to about 43.9%. So that tells you that it's quite effective. The reduction in the seizures for the control type with the normal medications was about 21%. So this was one of the first large clinical trials held in the United States. and there's an ongoing clinical trial as an extension to this. There's some other anecdotal case reports on the effectiveness of medical marijuana on seizures, and there's also been some studies in some places where they study the effect of medical marijuana in the animal model, and they found that THC stops the propagation. So there's all this overwhelming evidence of animal studies, case reports, case series. There's this report that just came out January 2018 on Lennox-Gastaut. So there's all this information that points towards the benefits of medical marijuana in seizures. And again, as in my last series, just a couple things to be cautious about is that normally dispensaries always ask about any history of schizophrenia or heart attacks, because it can cause paranoia, and it works also on the 5-HT, which is where antidepressants work, and serotonin can make the arteries narrow. So there's always concern for heart attacks, and there's been some studies, some reports that have come out. Okay, and in addition, it's also found in one study that at low doses it might actually help with autism. All right, so this ends part 6 of my series on medical marijuana and its current effects and current literature in epilepsy. I'm going to go over the different disease processes and then the effects, clinical trials, animal models, and the benefits. Okay, so this is Dr. Thornley signing off.